So hi everyone, today we're gonna present the eye condition presentation, which is analyzing trachoma. And this is presented by Table 9, Group 9, Jack Ho, Yiren Wang, Philip, and Bayliee. So first, we're gonna talk about what is trachoma. Trachoma is a serious bacterial eye infection caused by Chlamydia trachomatis. It mainly affects the conjunctiva, which is a thin layer lining the inside of the eyelid and covering the white part of the eye. It is leading infectious cause of blindness worldwide, most common in areas with poor sanitation and limited access to clean water. Spreads easily through contact with infected hands, towels, or flies. Trachoma usually starts as a mild irritation but can become much more serious over time. And next, we're going to talk about what happens to the eyes when trachoma exists. Over time, repeated infections cause damage to important eye structures. The conjunctiva becomes inflamed and irritated. Scar tissue forms inside the eyelid. The eyelid can turn inward, which is trichiosis, and eyelashes begin to scratch the cornea, clear from part of the eye. This constant scratching can cause pain and discomfort, blurry vision, and permanent blindness if untreated. So next, I'm gonna talk about why trachoma is a serious problem. Trachoma is not just an eye infection, it is a major global health issue. It affects millions of people, especially in developing countries. Most common in areas with number 1, limited clean water, number 2, poor hygiene, number 3, crowded living conditions. Children are infected early, but blindness often happens in later adulthood after repeated infections. It is preventable and treatable. If caught early, people can fully recover. If untreated, it can lead to permanent vision loss.
This is our diagram of trachoma. Let's start by having a reference of what a normal eye looks like. As you see here, this is an eye looking upward. As you see, the eyelid is not intruding on the cornea, which is clear as of now, and the pupil and the iris. Now with that out of the way, let's look towards the diagram of trachoma, or more importantly, the phases of trachoma. Starting up with trachoma's inflammation follicular. As you see, the upper eyelid is now inflamed with follicles that range from 0.5 millimeters to 1 millimeter. The next phase is a trachoma inflammation intense, where that inflammation intensifies into where it impairs the vision of the iris and the pupil. Next is trabecular scarring, which is the scarring of that tissue, which makes it very hard to blink, open your eyes, causes much discomfort. Next is trabecular trichiosis, where the eyelid now is turned in, with the eyelashes rubbing against now the cornea, which causes corneal opacity, which is the cornea becoming gray and causing blindness.
Trachoma is an infectious eye disease caused by a bacterium called Chlamydia trachomatis. The pathogen leads to inflammation in the eye, which over time can cause scarring in the inner eyelid. As the condition continues to worsen, the eyelid can turn inward and become a painful condition known as trichiosis, where the eyelashes rub against the surface of the eye and may eventually lead to blindness. The spread of Chlamydia trachomatis is closely linked to conditions such as poverty, overcrowded living environments, and limited access to clean water and proper sanitation. These factors make it easier for the infection to spread across communities. Trachoma is transmitted through direct personal contact, like touching the eyes or sharing contaminated items such as towels. It can also be spread by eye-seeking flies, particularly known as musca sorbens, which carry the bacteria from one person to another. The disease mostly affects young children, especially between the ages 4 and 6. However, more serious complications can be seen in adults because of repeated infections over time, causing cumulative damage to the eyes.
Treatment for trachoma, safe. Trachoma treatments focus on eliminating the chlamydia trachomatis infection using antibiotics and repairing damage from advanced cases via surgery. The WHO recommends this safe strategy, which includes surgery for advanced disease, antibiotics for infection, facial cleanliness, and environmental improvements. Surgery. Belamellar tarsal rotation, a procedure where a surgeon makes an incision in the scarred eyelid to rotate it outward, preventing the eyelashes from scratching the cornea. Epilation, pulling out eyelashes that are turning inward to reduce eye irritation. Corneal transplant, used in severe cases where the cornea is severely scarred and the vision is severely reduced. Antibodies. Azithromycin, a single oral dose, is highly effective and commonly used, especially for mass drug administration in endemic communities. Tetracycline, 1% ointment applied to the eyes, usually twice daily for 6 weeks, is a common alternative, particularly in early individual cases. Community treatment. The WHO recommends treating whole communities with antibiotics if 5% or more of children in that area are affected. Facial cleanliness and environmental improvement. Promoting face, washing and hygiene to prevent the transmission of the chlamydia trachomatis bacteria from person to person. Improving access to clean portable water and sanitation to reduce the prevalence of flies, which can transmit the bacteria.
Thank you for listening and for your attention. We hope you enjoyed our presentation about the trachoma of the eye. Then this is presented by Group 9, which is Jack Ho, Yiren Wang, Bayliee, and Philip. Thank you.